Hello, this is Dr. Riley, family physician in St. George, Utah, and today I want to talk to you about how low can you go when prescribing antibiotics. So this is based off of a study that was recently published in the American Academy of Family Physicians Journal. It was a Cochrane analysis or retrospective analysis of a database looking at antibiotic use and treatment outcomes. So these were meta-analysis based off randomized controlled trials, looking at very resources and databases. The authors that did the analysis was Dawson Han, McCann, and Onakpoya et al. I hope I haven't murdered her name there, apologize. And short course versus long course oral antibiotic treatment for infections treated in outpatient settings. A review of systematic reviews, published in the Journal of Family Practice. This was republished with an analysis by Mark Abel, MD, Master of Sciences, Professor, University of Georgia, Athens, Georgia. Okay, so let's get to the heart of it. So the short of it was, his analysis in republishing the data that was previously submitted was short courses of antibiotics are as effective as long courses of antibiotics in treating outpatient infections. So this is something that is counterintuitive to what we as providers have been taught through the years. I guess you could say growing up in medicine. Usually we're told that you need to make sure that you have the antibiotic course there long enough to make sure that all the organisms are dead. That has obviously changed over the course of the years, but unfortunately that sometimes doesn't necessarily still coincide with our prescribing patterns. So I want you as a patient and a consumer to be aware of this data, and that usually a shorter course of antibiotics is actually just as effective as a longer course and is less likely to cause side effects. And as a prescriber, so that we can cut down the number of antibiotics that we are prescribing and the length of antibiotics and see if we can improve our outcomes and reduce the harm that we might be doing to patients. So let's take a look at the data. So again, the overall assessment was shorter courses of antibiotics do reduce costs and may reduce the likelihood of adverse events. It was a systematic review of systematic reviews, called a systematic overview. So this is, again, taking many studies, pulling the data from that and putting them together to be able to look at what the final outcomes can tell us. So the reviews ended up with most studies having between around 300 and 5,000 patients, and then again they have multiple of those studies that they put together. So the conditions that they primarily looked at were urinary tract infections or UTIs, sinus infections or sinusitis, and community-acquired pneumonia, for most people just bacterial pneumonia or pneumonia as you may know it. They looked primarily at children as a group selectively, and then as adults. So in the children, they showed that 5 to 7 days for treating strep pharyngitis was just as good of 10 days of antibiotics. So you can cut your strep pharyngitis prescriptions for antibiotics down to 5 days and still be as effective. 3 days was as good as 5 days for community-acquired pneumonia. So a 3-day antibiotic would be just as good for pneumonia. I know that's kind of sometimes hard to swallow or think about, but again, that's something that we might need to look at prescribing patterns or habits. More than 2 days was as good as 7 days or more for otitis media. So most children really only needing about 2 days of antibiotics for otitis media and it will still resolve. And 2 to 4 days was just as good as 7 to 14 days for a UTI. Well, I don't know very many providers that give children 14 days of antibiotics for a UTI anyway, but they're saying that again, you could probably get by with between 2 to 4 days of antibiotic treatment and will be just as effective. So now let's look at the data for adults. So adults, they were saying 3 to 7 days was as good as 6 to 10 days for a bacterial sinusitis. And again, these are straightforward infections. These are not complicated sinus infections or patients that have had severe recurrent ongoing problems. These are just a basic acute new onset, maybe once a year kind of sinus infection type person. 3 days was as good as 5 days or more for uncomplicated UTI in non-pregnant women. So again, 3 days of antibiotics for most UTIs will be adequate. And 7 to 14 days was as good as 14 to 42 days for acute pyelonephritis. So if that urinary tract infection ended up going into the kidney, 1 week of therapy is usually adequate versus doing a much longer course. The authors also found that 7 or fewer days was as good as 7 or more days for community-acquired pneumonia, and 3 to 6 days was as effective as 7 to 14 days for urinary tract infections in older women. So again, urinary tract infections in general can be cut down to 3 days. They're saying pneumonia could probably be cut down between 3 days and a week, and that sinusitis can usually be cut down to 6 to 7 days. So that's a significant reduction in the number of antibiotics that we prescribe and in the length of course for most individuals, and hopefully will also increase compliance, because how many of us know someone who still has antibiotics left over from a prescription at home and they're covered somewhere because they never finished the course? So that's something to take in consideration. Again, they were also shown that shorter courses resulted in fewer adverse events, and especially in treating acute otitis media in children and acute sinusitis in adults. So as we reviewed in previous videos, adverse events from antibiotic use would include allergic reaction, rash, diarrhea, vomiting, intestinal problems, things along those lines. So if we can reduce that likelihood of that happening, then again, also hopefully we improve compliance with finishing the course, but a shorter course of antibiotics that patients would need for treating outpatient infections. I hope this information has been helpful. I hope it helps you become a better consumer, and also as a provider, hopefully it will help you tailor your prescribing habits and to see if we can help reduce misuse and inappropriate prescribing of antibiotics, and especially in the length, so that hopefully we can have them being taken the way they should be and patients being more compliant with that. And until next time, this is Dr. Radley, family physician, St. George, Utah, Pura Vida.